Hello, I'm Dr. Gina Mendoza, and I'm going to talk a little bit about plantar warts. Now, a wart is a virus, so it's caused by the human papillomavirus, and it can infect any part of your skin anywhere in your body. But the reason why they call plantar warts is because these are warts that occur on the bottom of your foot. So a plantar wart is kind of sometimes hard to recognize. Calluses can build up on the bottom of your skin and they can hurt, but a plantar wart really hurts. So if you have a virus or you're suspecting that you have a wart on the bottom of your foot, it's not just a normal callus that could be irritating. It would really be painful. And you got to be careful trying to trim your own calluses or dig anything out, doing self-surgery. That is a little bit dangerous when you're dealing with a plantar wart because you can make it bigger and they can multiply. So these are all bad things, okay? So the best thing to do is to go to a medical professional, like a podiatrist, and have them take a look at it. Because there's some ways you can tell if it's a wart yourself. If you have an alcohol pad or any alcohol at home, you can rub alcohol on the callus or thick skin and see if you notice any absence of skin lines. Your skin has lines through them. So a wart of the virus, actually, the skin lines disappear. So you'll have an area where you don't see your skin lines and then they'll start up again. Okay, so that's one way to check to see if it's a wart. Or another way is if you squeeze the skin and it really hurts more than just applying direct pressure, then that's another way you can tell. Maybe you have a wart and you don't need to be doing your own self-surgery. Okay? So a lot of people say, oh, well, what about those little dots in the wart? Okay, they call them seeds. People are often confused about what those actually are. That is definitely a wart. However, it's a wart that has gotten larger and has been there for a little bit longer time. So the early warts don't present with little dots in them. Okay. So the little dots is just your capillary buds that have come to the surface of the skin that are actually feeding the virus. So when we trim that, you have little pinpoint bleeding in that area, okay? And that's definitely a wart. So there are many different treatments for warts, okay? One, there are topical medications. Your doctor might want to freeze them, burn them, blister them. There are many different ways to attack the virus, and these are all destructive to the tissues. So you just have to be careful if you buy something yourself, like salicylic acid pads. Those work fine, but you just have to make sure and get it right on the targeted area because they can kill the good skin around the bad skin. So you don't want to do that. It's just best to come to a podiatrist because sometimes surgical excision is necessary if all those other treatments fail. One thing I've noticed in my practice, there's many different ways to treat this virus, and it's a very challenging problem to fix. Okay, even I've seen essential oils work on some of my patients that have warts that just will not go away with any other treatment options. So there are many different ways to treat, and we can talk about all of them if you come see me in my office. So this is Gina Mendoza talking about plantar warts.